right, let's begin with our big coverage and our continuous coverage here on ET Now and the India Development Debate, where we've been tracking for you everything that's been happening in the last 1 year. Exactly 1 year ago, lockdown struck. No one knew at that time for how long it would continue, how India would emerge on the other side of it, and all in all, we have been good on certain factors. Our mortality rates, the number of people who've died from COVID-19 have been relatively fewer. Yes, a lot of lives have been lost, no doubt, but relatively fewer have. On the other hand, the economy does seem to have recovered to some extent, but the pain of the lockdown of COVID-19 is still being felt even today. Even now, 1 year later, it's a sense of flashback as cases rise again. Another day of over 40,000 cases daily all across the country, 28,000 in Maharashtra, which continues to be the epicenter of COVID-19. In the midst of this, an appeal that was made by Maharashtra Chief Minister Uddhav Thackeray in the PM-CM meet last week has been heard, and now all above 45 years of age will be eligible to be vaccinated from the 1st of April. The appeals go beyond this though. Punjab Chief Minister Captain Amrinder Singh today has claimed 81% of people that have been tested in a small group were found to be suffering from the UK variant of COVID-19 and has asked for vaccinations to be opened from above the age of 20. His appeal comes after a recommendation by very senior medical experts, including Dr. Devi Shetty, who is the chairman of Narayana Health. And I'm pleased to welcome him on the show this evening as we talk about 1 year since lockdown. Dr. Shetty, thank you so much for speaking with us. Let me take you first to a little bit of a flashback where, 1 year ago, we were facing a spike in cases. We didn't really know what to do. What has that journey been like for you? And were you, like all of us, completely bamboozled when the lockdown was announced?
Not really. I think people who are in this field, we anticipated it, that it is going to happen, because all you have to do is go to the history of Spanish flu. It lasted for 2 years, had nearly 2 or 3 waves, and it behaved like more or less the same manner. So we were very, very keen that first time we went for a lockdown, because country was totally unprepared. We had just 1 or 2 PPE manufacturers. Doctors were wrapping themselves with the trash bin liners and wearing bicycle helmets to protect themselves in the COVID ICU. There was hardly 30,000, 40,000 ventilators in the whole country. So we were totally unprepared and we had no idea how to face this unknown enemy. But the lockdown gave us about 2 to 3 months of breathing time to prepare ourselves physically in terms of having all the PPEs and the ventilators and required medicine. And also we learned a lot from the mistakes done by the Western doctors from Western, I wouldn't say mistakes, the learning experiences. Because in the initial stages, everyone thought ventilators is going to be the savior. But over a period of time, we realized that ventilator is the last thing you want to use on these patients. A cheap steroid and oxygen is what is required. So we became a lot wiser in handling it. And this time around, we are a lot more confident, even physically, because now we are all immunized. We know that, we are protected from COVID. That makes a huge difference, because nobody understands how do you enter a ward with 50 COVID patients lying on the ICU bed. So it is like virtually going to a war. So essentially, we have learned a lot and we have become mature, but we are not taken by surprise.
The big news today is something that you have actually publicly appealed for to some extent, Dr. Shetty. So now those above 45 years of age can go in for vaccination from the 1st of April and can register themselves on the app Do you think there is a case for opening up this further from 20 onwards, the age of 20 onwards, as you yourself have argued for, especially in cases where there is a hotspot, where there's a flare up of infections?
See, first we have to understand our limitations. We know for sure there is vaccine is short supply. Okay, until that is met, we should really address the vulnerable. So government has done the right thing by vaccinating initially health workers, then 60 plus and others with co-morbidity, and now we have come down to 45. And once the vaccine supply channel is established, we have to go to 20 years or maybe 18 years, mainly because kids have to go back to school, college and school. Yeah, unless we vaccinate, see we are in the middle of the year. So it's very, very important that the kids have lost 1 year of school. That will have a huge consequences. So essentially, we have to ensure that the children go to school and colleges, workers go back to school, construction will resume, all the economic activity will happen. At the same time, not at the cost of life. Yeah, that can be ensured by vaccinating. And we have at least 4 more months in our hand. Because I can tell you that in Bangalore, in the next 2 weeks, the positivity in institutions where we check will reach up to around 23%. It's about 6 to 7% now, 23%. And we will have thousands of patients in Bangalore. And the same positivity will remain for at least 2 more months. And it will take another 2 more months for the number to go down. So we have about 4.5 months of COVID problem in city like Bangalore. This is based on the number what we studied last year. We have all the data, we analyzed everything. And we know that this is the way it's going to behave.
Dr. Shetty, a very interesting point you made. You're saying that vaccines are not enough. Now, here on the other hand, the government is saying that there's no shortages of vaccines. We're also hearing in some cases that there's vaccine wastage. So, what is the actual picture on the ground as you see it?
First of all, whether for the category of people government has allowed her to vaccinate, there is enough supply. We have not, actually we have less number of people. We have been allowed to vaccinate 2,000 people per day in our health city in Bangalore. And we hardly get 600, 800 people. So there is surplus right now. But if you reduce the age, then there may be a shortage. But since we are gradually opening it up, I think we should be able to manage.
I also want your comment on what has been declared recently, that the gap between vaccinations for AstraZeneca should be increased from about 28 days or 4 weeks to 6 to 8 weeks. And on the other hand, do you think this will help ease some of those supply constraints that you're talking about? Do we also need to very quickly have more vaccine candidates out there?
There is no doubt that we should allow as many vaccine candidates as possible. We have to open it up. If a vaccine was used in millions of numbers outside India, we should we should be lenient in allowing them to start vaccinating in India as well. There is no doubt. About the time gap, I took my second dose after 28 days because that was a regulation at that time. And I'm happy about it, because I believe that people need vaccine coverage only for the next 4 to 5 months. After that, we know that there may not be a third wave. And even if it is there, it will be lurking in some corner, which may not be at the mainstream. So I'm happy that I got it, but there are a lot of theories now coming up that second dose should be extended to more than 4 weeks. But I can tell you only after 2 or 3 years from now, you will know what is the right strategy. You will know everything. Right now, to be honest with you, I don't think anybody has a very clear idea about when do we take the next dose.
I want to talk about lockdown. Now, you have said publicly that when COVID fast hit, you were among the top medical voices that were calling for a lockdown to stop the infection. Now, a year later, you are saying that there should not be a lockdown and we should not repeat that mistake. Why have you changed your stand?
First of all, the first lockdown was not a mistake. It was the best thing what we have done. Because of the first lockdown, we are in a much, if a country has to be judged based on the mortality due to COVID, I have no doubt that we will be the winners. Why it happened? Because we prepared ourselves and we allowed the enemy to enter at our terms by locking down. Okay. Now, going for a lockdown now doesn't make any sense because COVID is already in the community. And even though what is the meaning of lockdown? Meaning of lockdown is you are closing down the establishments. You are closing the road, right? That's all you can do. But people are not going to change their behavior. There are a lot of studies done about the attitude of the people. 99% of the Indians are aware that they need to wear the mask to protect themselves and also the society. But only 44% of Indians wear mask, and among them, good number of them wear the mask on the neck, which is of no use. So that is one thing. The second thing is pandemic, the fatigue has set in. We are fed up. So this is a known entity. It's called Coronex, wherein people are indifferent to means of protecting themselves or the others. They feel that it's not, they don't want to go through it. Okay. And third thing is, it's very easy for us to, people in our position to say we have to lock down. What about the common man who has to earn his living on a daily basis, right? So it has a phenomenal consequences. In the Western countries, yes, they go for a lockdown, they go for extended lockdown. Why? Because government gives them enough money to stay at home. And we are in no position to do that. And next point is, you have to look at the density, the living conditions of the people. Everyone quotes New Zealand has been successful in locking down, control of COVID, and Australia is successful. What is the density of population? In Australia and Canada, it's hardly some 6-7 people per square kilometer. If you go to, I think, Gandhinagar of Delhi, per square kilometer, some 89,000 people live. And in the Dharavi slum of Bombay, 2 lakh people live per square kilometer. How is it possible for you to physically distance yourself? So lockdown right now, medically speaking, will not reduce the number of COVID. It may go down temporarily. You are only trying to hide from the virus by locking down. But you're not going to protect yourself from virus. Once you come out of hiding, virus will get you.
Well, one very important point that you made and which struck me, Dr. Shetty, is that you're saying that all of this will end in the next 4 to 5 months. Why are you confident about that?
I have no doubt about our government's ability to get the vaccine and cover at least half the country's population, and that's all what is required in the next 3-4 months. And I don't think this country will see the third wave. I am very, very confident. You have to realize that this country is blessed with outstanding doctors, nurses, technicians, and we are the vaccine capital of the world. We can produce vaccine for the whole world. So never underestimate our capability.
Well, that's what we hope for as well. And of course, that we will face this with even more resilience. Dr. Devi Shetty there saying that in his view, there will not be a third wave. We need to wait it out over the next 4 to 5 months as far as this second wave or this fresh spike is concerned. Thank you so much for joining us.